Hi. I'm Dr. Jitendra Patil. I'm a consulting orthopedic surgeon, joint replacement and trauma surgeon from Boisar, Mumbai. Working in Silila Hospital since last 16-17 years. A lot of trauma cases has been done by me and a lot of joint replacements. Today I'm going to speak about normal knee joint of a human being. Now this is a knee joint which is especially the right knee joint. Why it is right knee joint? Because you can see this is the fibula bone which is always on the outside part of the leg. This is lateral aspect. This is the knee joint which is made up of this thigh bone which we call as femur, and this is the leg bone which we call as tibia. These two bones forms a knee joint, and here if you can see this is how it moves, and what we call as the kneecap or the patella bone in our terminology. This is called the patella. This is the patellar bone. What happens is this patellar bone glides over the femur, and this is how the movement of knee joint happens. Now why this bone is there? Because it acts like a lever, so that it is attached to the quadriceps tendon, quadriceps muscles. This is the patellar tendon, and this patellar tendon is attached to the leg bone, and with that we can move around the knee joint and lift the leg also. And if you see in the knee joint, there are something called as a medial meniscus and a lateral meniscus. There are two soft cushion-like things in between two bones, so that it gives good lubrication to the joint and acts as soft pads. Also, there are certain ligaments in the joint. This is what we call as ACL ligament in between anterior cruciate ligament. Then there is a posterior ligament, what is called as the posterior cruciate ligament. And this is what we call as the lateral collateral ligament. And this is a medial collateral ligament. These ligaments is responsible for the stability of the joint, involving while running, walking, or doing any activities. This is how the normal knee joint looks, and normal healthy human individual has. But after certain age, what happens is because of body weight, because of certain body proportions, this bones, the gap between the joints gets reduced, and this bone starts getting friction with each other, and this cartilage, this what we call as meniscus, it also gets friable, and because of the friction between these two joints, the cartilage, this is something called as the cartilage, which is a thin part over here, and this cartilage is responsible for the glistening surface of the joint as well as providing nutrition to the joint and helps in proper gliding. Once this cartilage gets friction and damage, then the arthritis starts, and this is the reason of arthritis. This is what I want to explain today about the knee joint. In next video, I will explain you something about knee replacement surgeries and why it is required in which patients. Okay, thank you.